Hi, everyone. Today we're talking about a healthy heart. And joining us from Banner Health is cardiac surgeon, Dr. Rajeev Kathuria. And today, doctor, thank you so much for joining us. We're talking about heart disease because it is the #1 killer of women in the United States. So we're talking about women's health and how those symptoms of heart disease can differ from men and women. Can you talk a little bit about that?
Absolutely. A lot of people think that when you're having symptoms from heart disease, that you're going to have the classic symptoms a lot of people know about, which is chest pain or chest pressure. The reality is heart disease can manifest itself in many ways. While a chest pain or chest pressure is a common symptom, there are other symptoms that any person can have, men or women, and to include shortness of breath or nausea, pain down their arm or pain in their jaw or between their shoulder blades in the back. But women specifically tend to have symptoms that are not always classic. And many times it leads to people not being treated or even diagnosed in a timely fashion. For instance, women can have heart disease that can manifest itself only as perhaps lightheadedness or dizziness, feeling weak or having fatigue that's out of the ordinary. Shortness of breath is a common symptom as well. And a lot of the times these symptoms are ignored or not thought of as related to heart health.
So what happens when a patient puts off getting that care, when they delay that care?
Unfortunately, a lot of people can go on to have a heart attack because those symptoms were either not thought to be due to heart disease or were ignored. And that's the worst thing, basically, in coronary disease, that you can develop heart damage, which could have been prevented.
What if you feel very strongly about your symptoms, you go see a doctor, and maybe that doctor doesn't necessarily feel the same way you do? What should you do?
So it is not uncommon that women will go to their physician and tell them that they're having some symptoms and be told, well, you're either too young for this, or because you're a woman of a certain age, that is unlikely to be your heart. But if a person feels that something's clearly wrong and it's an unusual thing for them to be feeling the way they've been feeling, not part of their normal, then they should perhaps seek a second opinion, perhaps from somebody who specializes in women's health.
Mm-hmm. So a second opinion, very important if someone is feeling strongly that, maybe they need some extra attention. What about some tips for prevention?
I think a lot of the stuff is common sense, right? I think one of the most important things is weight loss. If you're overweight, weight loss and an exercise regimen is very, very important. If you have high blood pressure, you have to pay very close attention to that. Make sure that you're taking your medications. Weight loss will help with that as well. If you're diabetic, then make sure that your blood sugars are under good control. Nicotine cessation, because cigarette smoking is associated with coronary disease, both in men and women. So if you're a smoker, you should really try very hard to quit smoking. So those are all of the things that you can do to help yourself.
And most importantly, if you are experiencing any symptoms whatsoever that cause you to be concerned at all, you should see a doctor right away.
Absolutely. Don't take any chances. If you're having any of the symptoms we've talked about or other things that are bothering you, at least seek medical care. Go to your primary care physician, go to whoever you feel comfortable with. And if need be, go see somebody else if your symptoms persist and if you think it might be your heart.
Important information, doctor. Thank you so much for joining us. Good to see you. And thank you for joining us. We'll see you next time.